All right. Good afternoon, everyone, and welcome to the current webinar series, the North Central Region Water Network Speed Networking Webinar Series. For those of you who are not familiar with us, the North Central Region Water Network is a 12-state collaborative that is extension-led, working to steward water resources and spread the positive impact of Extension's water-related work. The current network webinar series, is a speed networking series where we feature 3 presentations on a similar topic, covering all ranges of water-related topics, from weaving water and the arts to nutrient management. Today's topic, I'm excited to feature 3 great presenters focusing on PFAS, what we know and where we are headed next. A few housekeeping items for you before we get started here today. We will have 3 roughly 10-minute presentations followed by Q&A. So please, followed by 1 Q&A session after all 3 presenters. So please put your questions for the presenters in the Q&A panel, which you can find at the bottom of your screen. We also use the chat feature, but that is mainly for technical issues or for sharing links or for introducing yourselves to others on the webinar today. So please make sure to list your questions for the presenters in the Q&A panel and your questions for any technical questions that you may have or comments that you may have in the chat feature. Another note is that we do use the upvote feature. So if you have a question and you see that someone else asked a really similar question, you can press the thumbs up to upvote that question. We will answer as many questions as we can get to and try to get to those questions that are the most upvoted first. Also, if you are having any audio issues, there is a phone-in option that can be accessed by clicking the up arrow on the mute icon and then switch to phone audio. This session is recorded. We do post all of our recordings on our webinar archive at northcentralwater.org. And you can find all the webinars from the past 8 years of the current webinar series on there. All right, so today we're going to be focusing on PFAS. We have 3 great presenters for you. We're going to be talking about PFAS research. Certainly, this is a topic that water professionals have become more aware of in recent years, and certainly something that we've been wanting to cover. We've covered this topic in the past, but today we're going to be looking at new research that's recently come out focusing on PFAS, as well as where are we headed next, looking at what the public, looking at the social and economic implications, as well as looking at policy and what is coming next. So we have 3 presenters from Wisconsin, Kentucky, and Illinois and Indiana. So without too much additional introduction, let's dive into our presenters. First up is Jeffrey Falinski. Jeffrey is with the DNR's drinking water section at the Wisconsin Department of Natural Resources. Previous to that, he worked in the Department of Environmental Management at Rhode Island, and he's responsible for coordinating and implementing the Emerging Contaminants Program for the drinking water section in Wisconsin DNR, and that includes PFAS. So we're excited to have him here today. I'm going to stop sharing and hand it over to you, Jeff.
All right, thank you. You can see my screen there.
Looks great.
Okay, thanks for inviting me to talk today. So in 2022, Wisconsin revised the NR 809 code, which requires most public water systems to sample and monitor for PFAS. So I'll be going over that data set today. Just a brief overview on PFAs, or per and polyfluoroalkyl substances. They're nicknamed forever chemicals because of how long they take to degrade in the environment. Some forms of PFAS take over 1,000 years to decompose. There are thousands of different compounds that are known as PFAS. All PFAS contain a chain of carbon atoms bonded to fluorine atoms. The carbon-fluorine bond is one of the strongest in organic chemistry. If you look at the structure there, you see the carbon fluorine tail is hydrophobic, while the head is hydrophilic. These properties make it so that PFAS assimilate along the air-water interface. This creates a film-like layer on the water, which makes them very useful as a fire suppressant for fuel fires. That's been one of its most important applications to date. But PFAS were also useful because they're water, oil, grease, stain, and heat resistant. So these non-stick properties have been useful in a number of products. Teflon was first discovered in 1938 and came on the market in the 1940s. They've also been used in other non-stick cookware, non-stick food packaging, cleaning products, stains, paints, water-resistant fabrics. So now we find PFAS just about everywhere in nature. They can travel by air, rainwater, and groundwater. Research has shown rising levels of PFAS in remote regions of Antarctica. Studies have found PFAS worldwide at low levels in almost everyone's blood, greater than 99% in the United States for some studies. Some possible health impacts of PFAS are impaired immune system, higher cholesterol, variety of cancers, developmental issues in children, reduced fertility in women. So the code was revised so that water suppliers for community and non-transient, non-community water systems need to take quarterly finished samples for PFAS using either method 537.1 or method 533. These are finished samples, so taken after treatment but before distribution. Samplers need to avoid using any type of PFAS materials such as Tyvek or Gore-Tex. Samples need to be chilled. Labs must analyze for all compounds in the method used, and all compounds above the limit of detection must be reported. Wisconsin's limit of detection is 2 parts per trillion, where the EPA's is 4 parts per trillion. Waivers from quarterly sampling are granted based on sample results, well conditions, population vulnerability, nearby sources. And here's the monitoring schedule. So each set of systems had a initial starting quarter based on their non-transient population. At this point, all systems have been initiated. We're still waiting on a handful of systems from last quarter, but systems that have submitted compliance samples have served a total of just under 4 million people, so over 2/3 of Wisconsin's population. Going over Wisconsin's PFAS standards, public notice is required to be sent to the system's customers when a compliance sample has a Wisconsin Department of Health Services hazard index exceedance. This is set at any sample with a HI value of 1 or greater. We'll then have a discussion with the system about some potential options they can do to reduce concentrations. Wisconsin also has an MCL for PFAS. This is a combined standard of PFOA plus PFOS at 70 parts per trillion, and this is based on an annual average of 4 quarterly samples, and exceedances here require corrective action as well as that public notice. And just a quick go over the DHS hazard index for Wisconsin. The hazard index is a sum of 18 different groundwater standards. You can see that formula on the bottom there. You'll notice that PFOA and PFOS plus their precursors all have a groundwater standard of 20 parts per trillion. As of to date, 1,845 systems have submitted samples. 70% have had 0 detects. 30% have some level of detect above the limit of detection. 32 systems have had that public notice requirement for having a sample over 1 on the hazard index scale, 2% of all systems. And here's a quick snapshot of some of those top systems so far. The 3M Greystone plant had a pretty high sample that's in Marathon County. Pine River School is just north of there in Lincoln County. But just 5 systems have gone over 3 on the hazard index scale, so not super high numbers there. The hazard index by county and type, we see Waukesha County had 7 systems which had that public notice requirement, though Waukesha County also has 164 systems that submitted samples. Marathon County has also had 5 systems with that public notice requirement out of the 40 that have submitted samples. For those of you unfamiliar with Wisconsin, Waukesha is just west of Milwaukee County, which is the most populated county in Wisconsin. Milwaukee County uses surface water from Lake Michigan. And Waukesha is the 3rd most populated county in the state, and Marathon County is the 10th most populated county in the state. Looking at system type, municipal community was the most common type with the public notice requirements of 16 of those systems out of the 32. So the MCL for Wisconsin is that combined standard of PFOA plus PFOS for 70 parts per trillion. So looking at that combined data, we've had over 3,100 samples submitted so far. 76% have had 0 detects, and about 87% are under 2 parts per trillion, with just about 2% of samples at 20 parts per trillion or greater. You can see some of those high samples there on the left. The 3M Greystone has been the highest sample so far, and that did exceed the MCL for the annual average. Pine River hasn't yet had a MCL as it's based on annual average, but it is looking like this quarter they will exceed that. However, it does just seem like those 2 systems will have the MCL violation. However, looking ahead at the EPA's proposed MCLs, these are individually placed on PFOA and PFOS at 4.0 parts per trillion. The EPA also has a proposed hazard index. This consists of PFBS, PFHXS, GenX, and PFNA. So an HI greater than 1.0 would exceed the MCL for the EPA. Comparing that to Wisconsin's data so far, 89 systems would violate the EPA's proposed MCLs based on past sample results. Looking at those by county, 16 of those systems are in Marathon County, so 16 out of the 40 there, and Waukesha would have 11 systems that would exceed that MCL. Looking at it by type, see municipal community is just about half of the systems that would exceed the EPA's proposed MCLs. Now looking at PFAS compounds by the detection rates, we see that PFBA had the highest detection rate. That makes sense. That's a short chain PFAS with 4 carbons. It tends to be a degradation byproduct of other PFAS compounds. If you notice the sample count, there is a pretty big discrepancy there. So method 537.1 analyzes for 18 different compounds. That's by far the most common method that labs are using in Wisconsin. But some labs use method 533. So that's why you see the different numbers there. I did also include on this slide hexafluoropropylene oxide dimer acid, or GenX, just to show that we've had 0 detects in Wisconsin so far. That's good news. GenX is often used as a substitute compound for PFOS and PFOA, and it is included on the EPA's proposed hazard index. So just a summary of the PFAS data. So just about 1,900 systems are required to submit samples for PFAS. And so far, we're just waiting on 45 more systems to submit samples. 30% of those systems have had a PFAS detect of some sort. 32 systems, or 2%, have exceeded the public notice requirement, with just 1 MCL violation so far, though a second one is pending. And looking at 89 systems would potentially violate the EPA's proposed MCLs, or 5% of all public water systems. And just a quick overview on water treatment. Your standard water treatment won't remove PFAS. So the 3 most typical methods used are anion exchange resin, high pressure membranes such as reverse osmosis, nanofiltration, or granular activated carbon. You do want to make sure that the activated carbon is PFAS certified. And you really want an expert to look at your system to know which will be the most effective treatment to use. There's pros and cons of each. The reverse osmosis, you can have up to 30% water loss. If you're pre-chlorinating, that can destroy the membranes. You'll want to look at the pH of your source water, organic matter content, is that those can compete for sites. If you're using granular activated carbon, those filter tanks can take up a lot of space, and you'll want to look at breakthrough times. So that will conclude my presentation, and feel free to send me any questions, and hopefully I can answer those.
Great. Thank you so much, Jeff.
Yeah, thank you.
All right. I'll have you stop sharing that. That's an interesting look at PFAS and PFAS notes in drinking water. Obviously, that's something that more and more states, more and more areas are getting a feel for in terms of what is the level of PFAS in our drinking water. We're now going to take a turn and look at wastewater and what research is telling us about the fate and transport of PFAS in our wastewater and how that is affecting our agroecological areas. So now we're going to turn to Dr. Tiffany Messer with the University of Kentucky. She has been with the Department of Biosystems and Agricultural Engineering with the University of Kentucky since 2020 and currently runs the Meso program in her lab there. So I'm excited for her to join us today and to talk a little bit about one of her research that both looks at PFAS and then a little bit on pesticides as well, since that was also included in some of her research questions. I will stop sharing, Tiffany, and hand it over to you.
Okay, can you see it okay?
Looks great.
Awesome, and I actually removed all the pesticide information, but if you have interest in pesticide, I'd be happy to talk to you about that later. So I'm going to be focusing on the fate and transport of PFAS entering, leaving, and flowing past water treatment plants, along with entering agroecosystems through biosolid applications. So before I get started, majority of this research was completed by two graduate students, Kira Sigler, who did her master's at the University of Kentucky and is currently doing her PhD at Virginia Tech, and Justin Caniglia, who did his master's at the University of Nebraska-Lincoln, which was where I was before I came to the University of Kentucky, and he's currently doing his PhD as well at the University of Nebraska-Lincoln. So this is a quick overview of PFAS. We are well aware it's a forever chemical. There's over 4,000 man-made chemicals from the substances that could be from PFAS. They have a strong carbon-fluorine bond that can lead to the environmental persistence, and that's one of the big challenges is how to for removing it. They have the hydrophilic head and the hydrophobic tail, which makes them very repellent for water, dirt, and grease. And then we use them in a lot of different areas of our lives. One of the primary ones is the nonstick cookware that we use every day in our homes. Along with things like candy wrappers, fast food packaging, and wrappers are some of the big ones that we see, particularly for the wastewater aspect of things, along with firefighting foams, which was talked about a few minutes ago. There has been a lot of research that is linking PFAS to cancers, high cholesterol, and particularly decreased vaccination response in children. This is one that's been a really big finding in the past couple of years. We also do find PFAS in surface water, groundwater, drinking water, soil, food, pretty much anywhere we take a sample, typically we can find some form of PFAS. There has been a lot of concern about this regarding the recent EPA proposed drinking water standards. And just to bring you up, these are the advisory levels that are currently being released from EPA. Pretty much if we can detect it, there is going to be a challenge that we're going to have to remove it likely, particularly for the PFOA. So if you have that link is also there for the release of that. For our project objectives, we ended up focusing in on how to quantify PFAS presence entering wastewater treatment plants in their influent, effluent, and in the biosolids. We wanted to improve our overall understanding of the prevalence of PFAS, and we were also looking at neonicotinoids in surface water and sediment surrounding wastewater treatment plants. And then we wanted to quantify the fate of PFAS in agro-ecosystems that receive wastewater treatment plant contaminated biosolids. So I'll be starting mainly focusing on these 2 wastewater treatment plants in Kentucky, and then I'll move into one that's in Nebraska, and some of the findings we had when we applied those biosolids to ag systems. So just for the study design, we're looking at these ones in Kentucky. We would take samples from an upstream location in the stream nearby. We would look at the influent of what was going into the wastewater treatment plant, what was leaving the wastewater treatment plant, and we'd also look at the downstream locations. In the streams, we looked at both sediment and surface water. Along with in the wastewater treatment plant, we were looking at the surface water and the biosolid applications. And we took a whole host of different measurements. I'm going to focus today just really on the PFAS analytes, although we did look at a lot of other analytical and physiochemical properties. One of the things we also considered is that in these 2 wastewater treatment plants we were looking at, one was utilizing UV as a treatment, while the other one was using chlorine disinfection for their final treatment. And we only were able to look at this for 2 months. It was funded under a relatively small USGS 104B project. So there's only 2 months of data. So when we were doing this, we deploy what we call Polar Organic Chemical Integrative Samplers, also known as POCIS. And what they do is they allow us to take time-weighted averages of the concentrations we would see in these different areas. So we deploy them typically for around 30 days, and then we come, or 2 weeks to 30 days. And then we come back and we're able to actually get the mass that was attached to the membrane and be able to determine kind of an average concentration we would see in these systems. All of the PFAS and pesticides that we ended up looking at were analyzed at the Nebraska Water Sciences Laboratory using LC-MS. And these are just some pictures of us sampling the sediment here on the lower left, and then the wastewater and surface water collection, that's Kira on the upper right. We also went ahead and measured water volume, and this was really critical because we also wanted to understand the amount of loading that we had for a particular contaminant. So we used a Hobo data logger and then did some surveys to be able to determine the volume of water that was going through these rivers. And then we worked with the wastewater treatment plants, and they let us know what their inflow and outflow volumes were as well. Just to give a little bit of background on the sites that we're looking at, I've got the watersheds in the top and then the sewer sheds in the bottom of these images. And overall, our first wastewater treatment plant, we're going to refer to that to urban the rest of the time. And as you can see, majority of this watershed and sewer shed are urban, versus our wastewater treatment plant 2 was a more rural location. It was a little bit larger of a watershed, but overall we had a lot more cultivated crops in these in this particular watershed compared to the developments. Just to introduce the Nebraska study, this is the 3rd wastewater treatment plant that I'll be talking about today. And we also did a very similar analysis for this one. This one, I don't really have as much information with the watershed, but I do have the plots on the right side. And this is where we would actually go and apply the biosolids just to give you an idea of what was happening there. And you can see these pipes that are coming out of the, with these tanks below them. And that is how we were capturing the runoff for these sites. So some of the results that we found, we're going to start with the Kentucky ones first. And so was there PFAS in the water? And we did, every single site for aqueous samples, we did detect PFAS. We detected of the 18 analytes that we were looking at, 15 of them were detected. Concentrations ranged from below detection up to 386 nanograms per liter, and it was dominated by PFAS. For this one. And particularly, we found a very high concentration at the urban wastewater treatment plant 1 upstream location. This is before we ever get to the wastewater treatment plant. And we really had a pretty strong link that this was likely coming from a firefighting training facility that was nearby. So just to show you like how high those particular land practices can be, like they had a significant amount that was coming in. When we looked at the sediment and the biosolids, there was less detection than compared to the aqueous samples, and the concentrations range from below detection to 4.6 nanograms per gram. These were primarily dominated by the PFAS and the PFSA, specifically the PFOS. That was our big dominated one that we were seeing for those, which is one that is one of the recommendations that will be regulated with the EPA if that goes through. So how did the influence that what was coming into the wastewater treatment plant compared to what was going out, the effluent of the wastewater treatment plant? What we could tell, and through statistics, we also verified this, the effluent typically had significantly higher concentrations of PFAS compared to the influent. Now, does that mean there's more PFAS coming out of the wetland or out of the wastewater treatment plant compared to the coming in? Likely not. It just, we probably aren't able to measure those particular PFAS forms before they start to actually degrade into these products that we are able to measure. We also found that the wastewater treatment plant in the that was in the urban area had greater concentrations than the rural. And we also saw for both of them that they had higher concentrations in July compared to April. So in the more summer period versus the more spring period we were monitoring. Every analyte had significant concentrations in the effluent compared to the influent at least once during the assessment. And the significant results were more common, like I said, in the July with 92% compared to 68% in the April time period. All right, so let me go to the next one. How do they compare with the upstream and the downstream locations? For wastewater treatment plant 1, the more urban location, it was really fascinating. We actually saw that the downstream location was being decreased, and this was due to that really high concentration that we had upstream to that, likely from the firefighting training facility. Ultimately, the wastewater treatment was diluting the water, so that we had a lower concentration there. For the wastewater treatment plant 2, we saw increases downstream for the wastewater treatment plant. And I should have pointed this out earlier. For Kentucky, this is really critical. The reason why is that 98% of our water is surface water dependent for drinking water in our state. So when there's really high concentrations of PFAS coming in, that could potentially impact downstream users. So that was one of the big concerns of why we're interested in what's leaving these wastewater treatment plants. We also, let's see, that was for that. And then we also looked at the amount of percent changes for the discharge of the PFAS. So we saw that 86 to 99% of what was leaving, PFAS leaving the wastewater treatment plant was in the form of effluent, while it was 1 to 14% was in the biosolids. And we also saw that around 38,000 milligrams per day was leaving the urban wastewater treatment plant 1 versus around 1,600 was leaving the wastewater treatment plant 2, which is the more rural location. And all of these values are just showing just the changes of numbers. So ultimately, we're just finding there's a higher percentage leaving than what's coming in, likely due to how we can measure. And so how does this compare really to the EPA recommended water standards? What we looked at was, where in 2021, it was 70 nanograms per liter. Then the recommendations came out for the 0.004 nanograms per liter. Ultimately, that is our detection limit. So if we detect them, then that means they need to be addressed. So we also looked at how would this impact our hazard indexes if we were to look at what was leaving these wastewater treatment plants, or even inside of our drinking water sources potentially. And what we ended up finding is that we had a significant amount of these were getting well above the 1 hazard index. And that includes for the influent, the effluent, and the downstream and upstream locations of our streams. So now we're going to switch gears a little bit and talk about this Nebraska field site. So for that wastewater treatment plant, we were getting various releases of grams per day for our sites. And you can see for the effluent particularly, we're getting a little over 10 grams per day of PFAS leaving that site. And then we also looked at how much PFAS was really going to be in the biosolids. And for this particular wastewater treatment plant that we were working with, we did see that there was quite a bit of the PFAS, particularly in the form of PFOS, very similar to what we saw in Kentucky, inside of the biosolids. And so what we ended up doing was applying these biosolids to the ag locations, and it was around 22.9 nanograms per gram. Then they comprised about 77.5% of cumulative PFAS mass there. And the PFOS, as I mentioned, was the most abundant, and they were accumulating the biosolids at 72.8 grams per day. So it was a pretty good amount. So then we applied it to the ag fields, and we looked at this graph here is showing you the average mass concentrations in milligrams of the PFAS that we found on the municipal biosolids land applied treatments in the top 10 centimeters. And so what we ended up seeing is in the biosolid applications, we definitely had more PFAS in our ag soils in this location compared to the soils that didn't receive the biosolids. However, we did still see that there was PFAS in the soils at these ag sites, even though they had never received biosolid applications. So we're still getting PFAS into the system in other ways into these ag systems. We also saw that with our rainfall capture, that as time went on, we had less PFAS that would end up in our runoff. So it's easily mobilized and likely going to be lost over time for rainfall events and entering our downstream aquatic environments. So in conclusion, for the PFAS for the Kentucky sites, we saw that the effluent for the wastewater treatment plant commonly had higher concentrations of PFAS compared to our influent, particularly the long chain types. We saw that disinfection methods did not really appear to impact the PFAS transformation, but season did. We saw a larger increase in July. And the wastewater treatment plant one, which was the more urban, had more of an impact and was generally diluting the downstream location due to that upstream PFAS source. And then the more rural wastewater treatment plant had less likely to significantly impact and concentrate downstream surface waters. And then the more industrial the region and the watershed, the more likely you're going to be able to see higher concentrations. And then lastly, for this one, most PFAS were in the aqueous compartments compared to the biosolid compartments. For Nebraska, we did detect it in both the soil and the runoff when we did the lane applied biosolids. We did see that there was a decreased amount of runoff over time, and we did provide, this did provide evidence that there was introduction of PFAS to agri-ecosystems. Several people I wanted to acknowledge, references, and then thank you for your time today.
Wonderful. Thank you so much, Tiffany. All right. Great. I appreciate both of those presentations. And I know we're getting lots of questions in the Q&A, which is wonderful. Keep them coming in and we'll try to answer as many as we can after our third presenter. So our third presenter is Sarah Zak. We've been talking a little bit about the research that's regarding PFAS, but these research obviously have implications, and there's also the less physical research in terms of the social and economic input implications of PFAS. So that's what Sarah is going to be talking about, and a new scoping report that is out by Sea Grant. Sarah is a pollution prevention extension specialist with Illinois Indiana Sea Grant and the University of Illinois Extension, and she's been there since 2011. You can read her full bio there if you're interested, but I will go ahead and turn it right over to you, Sarah, for the sake of time.
Thank you. Let me share. Okay, is everything good?
Looks great.
Okay, great, thank you. Yeah, so now for something completely different. So I'm going to talk about some work that we're doing at Illinois Indiana Sea Grant to look at social and economic impacts of PFAS, specifically in the Great Lakes and Lake Champlain region, and some of the work that we're doing to sort of establish the needs of the region in this regard. So first, I just want to start. I'm an employee of Illinois Indiana Sea Grant. Many people aren't aware of what Sea Grant is, but we at Illinois Indiana Sea Grant are a partnership between Illinois Extension and Purdue University on the state side, and then the National Oceanic and Atmospheric Administration at the federal side. And the National Sea Grant Office, which is a part of NOAA, was established in 1966, and they support 34 university-based Sea Grant programs that are found in every coastal and Great Lakes state, Puerto Rico, and Guam. And these Sea Grant programs are typically based at the land-grant universities, but not always. So before I go any further, I just want to acknowledge my colleagues that I've been working with on this project. Carolyn Foley is the research coordinator for Illinois Indiana Sea Grant. Thomas Hook is our director, and Aman Kohli is the coordinator for this particular project. And those three folks are at Purdue University, while I'm at University of Illinois Extension. So to promote the assessment of PFAS in the Great Lakes and Lake Champlain region, Illinois Indiana Sea Grant was awarded a competitive grant from the National Sea Grant Office and NOAA in 2022, which was part of an emerging contaminants special competition. This was a part of the FY21 appropriation from Congress and was a directive from Congress for Sea Grant to address emerging contaminants. So this was announced in April of 2022 that Sea Grant would be funding 2 projects. It was open to all Sea Grant programs. And there were really 3 priorities within this research. And again, this is coming from Congress. It was to be a regional research effort. There were supposed to be state partners represented so that the Sea Grant programs were working closely with the state agencies, and an emphasis on working with underserved communities. So we had 4 objectives in our project. And before I get into those, I just want to mention one more thing. Some have questioned why we have a socioeconomic focus on this work. And the primary reason is the amount of funding that we were awarded. These were relatively small awards. They were about 3 years and a little over $500,000. But 400,000 of that was to be distributed as part of a competitive research program. So we had a very small amount of money to fund projects. And the idea of funding fate and transport studies or monitoring studies, we didn't really think that we would be getting much bang for our buck. That's not a lot of money to study fate and transport for 18 months, install a monitoring program for 18 months. So we decided to focus on something a little tangential to a lot of that work and start to address the needs sort of on the social and socioeconomic side of things. So our first objective was to conduct scoping activities to try and identify research gaps in terms of the social and economic risks of PFAS. And as a part of this, we established a technical advisory committee. We hired Aman as our project coordinator. We planned and executed scoping sessions and a survey, which I'm going to talk about, and developed a report about that and distributed it to all of our partners. Then we conducted a Great Lakes Regional Research Competition using the information that was gathered in that scoping report. So we drafted and distributed an RFP and ultimately recommended 4 research projects for funding. We're going to support and monitor those research activities over the course of the 3 years. These are, again, 18-month projects that have just gotten going within the past few months. So we will be hosting public webinars to update people on the status of these reports, making sure that the researchers are well connected to Sea Grant specialists who can help get this information out to state and tribal partners. And then the 4th is to make sure that those research results get shared beyond just the Great Lakes. And we'll do that by hosting webinars and meetings to try and communicate these findings, attend both regional and national conferences to share these research results. We'll have a white paper that we'll generate from the entire project results and then make sure that we share these results out with Sea Grant. So one of the first things we did was to establish our advisory committee, and I just want to acknowledge these folks now because they were really instrumental in helping us to develop the format and content of the scoping sessions, which is ultimately the foundation that this whole project rests on. So a huge thank you to these folks. The scoping sessions took the form of 3 3-hour virtual sessions that we conducted in March of 2023. We had more than 70 participants from more than 45 different federal and state agencies, tribal nations, academic institutions, and consulting firms. And the format of these sessions was essentially that we invited some presenters to set the stage for different topics and then facilitated discussions where we gathered information in sometimes very traditional ways and some interactive ways. And then we followed that up with a survey that was taken by about 50 people to try to capture anything that we may have missed and to give folks who weren't able to attend all sessions an opportunity to comment on content from those sessions. So these were the 3 sessions. The first focused on risk and exposure, the second on mitigation and remediation, and the third on governance and prevention. And each one was sort of guided by a question of the day. And you can see those here. And so the information that I'm going to present now is sort of a synthesis of the data that we gathered from the scoping sessions and the survey. And I'm going to do this quickly. So we focused on 7 different key outcomes and gathered information on 7 different sort of topic areas. And these are them. And so I'm going to sort of share a snippet of information now from each one of these 7 key areas. So in terms of sources and exposure routes of PFAS, there really wasn't anything that was revolutionary uncovered here. I think we're all pretty well aware of it. But what we've done is we've established this as sort of the top sources and routes as identified by these regional professionals. So we had ingestion through food and water as the top one that was identified. And this was, drinking water, fish consumption, water being a source for aquatic animals and plants, as well as consumption of aquatic animals and plants. So diet exposure as well as environmental exposure. This is definitely the most studied route, I think, so it's not surprising that it was identified so highly. Oh, I didn't mean to do that. The second was inhalation through air and dust. And this is due to the presence of PFAS in household products, and then again, occupational exposure to PFAS at airport and military facilities, as was alluded to in the previous presentation. And then the third is dermal exposure with consumer products. So kitchenware, cosmetics, personal care products, clothing, food packaging, carpet, paint, and a lot of places where the use is undisclosed. But overall, I would say the key takeaway for this area was the absolute proliferation of PFAS into people's daily lives. And you combine that with sort of the lack of knowledge that we see about these contaminants, and then that leads to potentially high exposures. So moving on to health risks from PFAS, again, nothing revolutionary here, but again, we've identified these as being the top health risks as identified in our regional capacity from folks that are working on these issues. So we have human and ecological health risks, and these are pretty much what you would expect. But I would say that overall, the key takeaway from this was that in addition to just these sort of, not traditional, but these well-known effects that PFAS has, both human and ecological health, that we really need to focus on the dose, because it varies with the exposure route, and it's really the total dose that's key, and the type of PFAS that affects the risks as well. So that sort of leads, again, to a conclusion that the health risks are often unknown. Moving on to risk assessment, we wanted to get information from these folks about what they think an effective risk communication strategy would be. How do we communicate information to people? Who do we need to be talking to? What are we telling them? All of these things are key to effectively communicating the risk of PFAS. We know that no single approach can work for all the groups that are possibly affected by PFAS. So we have to consider the who, the what, and the how. Who needs the most info? Who is the least aware? What are the alternatives? How does the community or the audience want to receive this information? And so this is a table from the appendix of the report. It's taken directly from the report. And this is from the survey. And the question was, focusing on those who live, work, and recreate in the Great Lakes and Lake Champlain regions, and considering the broad suite of PFAS chemicals, what's the relative level of awareness? What do you think the relative level of awareness is within the following groups about the risks of PFAS and how they protect themselves and others? So the gray shading indicates that group was the top 3 groups in that category. So you can see that folks who took the survey thought that manufacturers, workers, and people who live near airports were sort of the most aware. Healthcare providers, municipal water suppliers, and large city residents were next. The least aware were students and workers at school, people who use well water, subsistence communities, and rural communities. So this starts to get at where state agencies believe they need to be putting their resources into as far as risk communication and outreach. So what to communicate then? So this is, again, some data pulled from the appendix of the report that was from the survey. So the question here is, what information is needed to effectively communicate risk to the groups that are least aware of PFAS risks and how to protect themselves? And they were able to select all that apply. And you can see that the folks who took the survey thought that guidance on how to reduce or prevent exposure was the most important thing to communicate. And also information about exposure and health. So why should they care about this, essentially? and then, sort of so on and so forth. As I mentioned, the needs of each community and audience are going to be different. So when we start to do this work, you need to assess needs before you start, because again, no single approach works for the full range of groups. So these were some of the things that were identified as being successful with communities in this type of outreach. And most of these are pretty traditional, right? We commonly distribute fact sheets and brochures, hold public meetings or focus groups, work with public groups like advisory groups, and health clinics was a good one that was identified as well. So partnering with organizations like your local Sea Grant program could also work well, because Sea Grant often has strong partnerships with community organizations. That's one of the hallmarks of the Sea Grant program. So here we have a list of all of the sources of PFAS that were identified as currently being targeted or that should be targeted for remediation in the Great Lakes, Lake Champlain region that were identified by this group. And this is a lengthy list, and I'm not going to read it to you. The takeaway here is that solutions are available to all of these things, but they differ in a really wide variety of ways. And the biggest, I would say, is cost effectiveness. The one that was identified most is cost effectiveness, because the participants strongly suggested that the burden for these treatment costs needs to be shifted from municipalities, from taxpayers, towards the parties that are responsible for the contamination. Next, we talked about governance and prevention at the state level. We had each state fill out this table so that they could tell us what they were doing currently in their state. And every state that participated has one of these tables in the report. This is an example from Michigan. So you can see what the state of Michigan is doing to prevent PFAS contamination. Different states have invested at different levels, at different capacities in, pollution prevention and monitoring and surveillance and all of those things. And so we wanted to identify that and make that information available to everyone. And that really leads to sort of this last one, which is challenges to adopting a regional consensus. Why can't we adopt a regional consensus to this? And a lot of challenges were identified. There were really 6 main challenges that were identified. We'll just get them up there in the interest of time. And I would say that we're not solving the problems here, right? We are just identifying what we think, or what the participants think are the issues that need to be addressed before we can address this in a regional way. And since contaminants, especially aquatic contaminants, don't respect state borders, right? Rivers flow from state to state. There really does need to be some sort of regional consensus to address this. Research and knowledge needs were also addressed. And again, a huge list of research and knowledge needs. There's so much that we don't know or need more information about. But specifically, what I want to highlight here are the ones that we think our RFP that we released will help to address. These are the ones that we picked out that we thought would fit well in our RFP, because we used this scoping report as the basis for why we crafted our research questions in the RFP the way that we did. And so just to quickly share a little bit about the RFP and the funded research. The RFP was open from May to July of 2023. And just last month, we were able to announce the 4 projects that were recommended for funding. And so the first is at UIC, University of Illinois, Chicago. And it is essentially a survey and sort of information gathering effort on fish consumption habits of anglers of color in Chicago. The second project is out of University of Wisconsin-Madison, looking at PFAS message testing with the public, and specifically with Latino populations and municipal water users. Third is at Penn State University, and it's developing an online risk assessment tool for PFAS exposure. And then the 4th project was at the National Sea Grant Law Center, looking at PFAS laws and legislation in the Great Lakes region. And so with that, I just wanted to share information about how you can access the scoping report if you take a picture of the QR code, it'll take you right to it. The web link is there, and I'll drop the link in the chat as well. And if you're interested in reading more about the project itself, we have a page on the Illinois Indiana Sea Grant website that gives more information about it and links to the report and the RFP and everything else. And that's it. Thank you.
Thank you so much, Sarah. I really appreciate it. I know with PFAS there, I think you said it really well. There's so much we don't know. And I think that's certainly true for the physical research, but we're also seeing that on the social and economic side of things. So I think it's really great to highlight some of that, as well as some of where that research is headed and where we're going to be going next in terms of looking at the implications. All right, I'm going to dive right into the questions because I know we have a lot, and we'll try to get to as many as we can here. I know some of these questions were answered. I'm going to go with those that are the most upvoted first, so be sure to upvote those questions. This first question is for Tiffany. I'm going to add you here. For the biosolids, were you finding that the heavier compounds, including PFAS, settled more in the solids than in the effluent wastewater?
So that's a great question. And we were seeing the longer chains more often, but overall, majority of it was going into the effluent water. So there really isn't a settling happening. It's just a matter of where it's attaching to organic carbon. And it's likely being impacted by that organic material of, how much is going to be able to go into the biosolids. But the max we saw was 14% of, the overall amount of PFAS that we were measuring in these systems. And one thing I will emphasize is these are just the 18 that we were able to measure. There's thousands of these. So there's another question that's been coming up of, well, how is it increasing throughout the wastewater treatment plant? This was likely increasing because there were precursors that we weren't measuring that were breaking down in the wastewater treatment plant. And while we aren't, regulating or considering regulating those, they could be toxic. We don't know. We haven't done enough research to really know if they're safe or not of these other thousands. Some of them we don't even know exist yet. So I think that's one of the things that has been a concern as well.
Yeah, that's a great point. I did see that question there about are all PFAS chemicals toxic? Short answer is we don't know, right? Any idea why the concentrations you were seeing were higher in July? I know your answer had put in a written answer to that, but I want to make sure that that is answered.
Yeah, sure. So one of the things that we don't really know. That's the real upfront answer to that. Some things we suspect might have been impacting that is typically firefighting training facilities will do a lot of their training in the summer. So that is a probably likely reason why we saw an increase inside of the upstream location. The other thing to consider is that temperature does impact how these precursors can break down. So it is warmer during July than it would be in April. So that is also potentially an implication. The other thing is the dissolved organic matter, the overall characterization of it does change throughout the year. And so that could also be an implication. These are all thoughts that we have, but we have not been able to prove them with science yet.
Great, thank you. This next question is for Jeff. Jeff, I know there was a question about the where to find this information in terms of the Wisconsin data, where to find which of those public water systems are perhaps ranking on the higher end of the hazard scale. And I know you did include a link there. I don't know if you have anything else to add to that.
No, I was just gonna say that, yeah, the data set is all publicly available. I did put a link there in the Q&A. I can put one in the chat too, or I sent one to Martha and she said she'd send it out after the presentation. But yeah, feel free, anyone can look through the data set there. And I did provide that list of systems in Waukesha with some elevated concentrations.
Wonderful. And I think you kind of also noted this as well in terms of surface water versus groundwater. This has a lot of implications in terms of how we make sense of Tiffany's study there in terms of a lot of our states are groundwater, but certainly in the Great Lakes area, we have surface water. And in Wisconsin, we are to have both. Though
yeah, so there's a total of 1,890 systems that were required to sample. 19 of those use surface water, the rest are groundwater.
All right, great. All right, it does look like there are several questions here about any knowledge about crop uptake of some of these PFAS chemicals. Tiffany, do you have anything you might want to note on that you didn't put in the Q&A?
Sure. So I put several, I believe, open source reviews on of what people have been finding with crops. We do find that it does accumulate in crops. It does depend on the crop. It does depend on if it's a short chain versus a long chain. Typically the short chains are the ones we're more worried about with crop uptake. And it also depends on the type of soil you're looking at. So the amount of organic matter that's in your soil has been found to actually impact it as well. But I put a few reviews there that you can review, look over. One of them I think is actually from Purdue, who's been looking also at this in pretty deep context. So it also obviously depends on the type of crop.
Right. Great point. Okay, another question for you, Tiffany. Are those passive samplers used to take out PFAS only using membrane to accumulate PFAS or any type of resins to help absorb PFAS from the surrounding matrix?
That's a great question. So these were HLB samplers and for our membrane that we were using. Depending on the particular analyte you're looking at, HLB might not be the best. We worked with the Nebraska Water Center and they were on this project with us, and they were able to create the method that and prove that these filters or these membranes were doing a very good job of accumulating these particular forms of PFAS on them. Now, again, this might not work as well for other types. But that's one of the things that we did when I was showing that calculation is we did go and do an entire assessment to make sure that they would be absorbing to them. Now, if you're looking at different, like we also use them for things like insecticides and antibiotics, and they've worked very, very well for those as well. But again, it depends on the type that you're looking at and the type of membrane you're going to use. Okay,
great. And a question from Marisa that's kind of directed at all three of you. Tiffany, you may be best to answer, I'm not sure. Is there a way to measure PFAS concentrations in the air? I know all three of you mentioned that the air is a potential avenue that folks are getting exposed.
That is a great question. If any of the other panelists would like to help, that'd be fantastic. I do know there are people doing it, but I'm not familiar with the technology.
I know I'm aware a lot of the PFAS that's measured in air is measured as atmospheric deposition. So they'll look at what sort of gets brought from the air into water and look at it that way. But that's not my area of expertise. So that's the extent of my knowledge about it.
Great. Jeff, anything to add there? I know you're in public drinking supply, so I get it.
I've seen a number of different studies. Each one will kind of say different amounts for routes for exposure. I guess I've seen a rough estimate, about 10 to 20% is inhalation plus dust for PFAS contamination. I also know the EPA, when they had the webinar for the proposed MCLs, they were asked about what percent do they think PFAS is coming from drinking water, and their estimate was around 20%. The rest coming from dietary.
Interesting. I hadn't heard that fact before. Thanks, Jeff. This question is for Sarah, and then it's kind of noting that in the beginning of your report, some of the imagery showed mascara or personal care products in that way, and they never thought of PFAS chemicals being in makeup products. I know someone put in a list of the Environmental Working Group website. I think it would be, a question. Obviously, there are lots of products where PFAS is that we might not be aware of. You mentioned that public awareness is one of the key aspects here. Is there any resources that you might suggest in terms of where folks can find out or educate themselves or educate their constituents about where PFAS is most prevalent?
That's a really great question. And actually, I think this is a big gap. So if anybody else that's on the webinar has some of this information, I would love to see it. I know I'm aware of some really interesting work that was done in the Peasley lab at Notre Dame, where Dr. Peasley sent a undergraduate student to Ulta and had them sample a lot of the makeup that was available on samples. Now I can't talk about cross-contamination or any of that stuff, but it was a really interesting study, and he's published some papers on it and published some work looking at personal care products on this. And I know I can just say that waterproof mascara and liquid lipsticks were the two biggest culprits. The right things that involve staying power and being waterproof have the highest amount of PFAS in them. And but I do think that that's really a gap because it's a big exposure route, and a lot of people are not aware that they could be putting PFAS on their lips every day.
Yeah, interesting. Oh, well, I so wish we had time for more questions, but I do see that it is 3 o'clock Central Time here. So I want to be cognizant of our speakers and the time that they dedicated today. So I will close up the questions here. I know folks have been trying to answer some of these questions written, so I appreciate that. If you do have a question today that you were not able to get answered, which I understand, maybe the case, if you have a burning question, I did want to put our presenters emails up there on the screen. You can feel free to email them if you have a burning question. If they aren't able to answer, they might be able to at least point you in the right direction. So thank you to each of our presenters for their time. I know PFAS is such a big topic. We're doing really short presentations on it, which can be a challenge, but I appreciate just giving a taste of this topic from 3 different perspectives or angles. For those that joined late, this presentation is recorded and we will be putting it up on our archive and our website, northcentralwater.org. And we will also be putting a couple of the presentations. I believe we have the slides for Sarah's and Jeff's that we can put up. Tiffany's does include some work that's not published yet. So, but feel free to reach out to her specifically for more information on that or follow up or questions. So with that, I will close out the webinar for today. We will be joining again in February, but in the meantime, I hope you have a great rest of your day and thank you again for joining us.